Everyone, my name is David Crawford, and I'm editor-in-chief at Grand Rounds in Urology. It was just over a year ago that I was asked to look at the galley proofs of a book that is coming out and is now out called Prostate Cancer: Expert Advice for Helping Your Loved One. And I wrote, after reading it, I said, this is amazing. And my comments were, and I'll read this: my career of 40 years has revolved around prostate cancer diagnosis and treatment. I wish this book would have been available for my practice to bridge and fill the gap between the patients and their significant others. I now recommend this to all my patients with prostate cancer, and that's the truth. Joining me is one of the co-authors of this book, a person that I've known for 5 decades, I think
so.
David Mobley, who has just been a stalwart and a very hard working urologist in the state of Texas. And Dave graduated from Arizona and Tennessee and postgraduate work at Baylor, and has been in that area ever since. The things that he's accomplished in his career, many areas of urology, things like the no scalpel vasectomy that he was involved with, a lot of experience with various integrations of early treatments and options for men with prostate cancer and other diseases in men's health, and it goes on and on and on. But I want to get right to Dave and start talking about this book, and he did this with a very good friend of mine, Neil Baum. Neil, as many of you know, is a regular part of Grand Rounds in Urology. He's a clinical professor of urology at Tulane Medical School in New Orleans. He claims he's retired, but I've not seen any indication of that, as busy as he's been. Neil has written a lot of books and about practice and things like that, and he's a regular here in Grand Rounds in Urology. So, Dave, welcome, and it's our honor to have you here. And I'd just like to start out by asking you, what motivated both you and Neil to write this book?
Neil actually came across a book about breast cancer, and it was a book designed for the partner of a woman who has breast cancer. And he thought, well, there's nothing out there like this for urology. He and I started talking, and we came up with the idea of writing this book. And then over a period of a year and a half, it materialized. And along the way, we brought in a third author, which I can tell you about here in a minute too.
Okay. So what there's a lot of stuff out there that's available for patients with prostate cancer on the internet, which we didn't have a long time ago. But some good, bad, and ugly. There's really not a lot of great books out there that are in the arena. Who was the audience for this book? What was your plans when you and Neil and Dr. Key started this?
Originally, the idea was this would be, in most cases, is going to be a spouse who will be the partner of a man who's been diagnosed with prostate cancer. And through our many years of treating prostate cancer patients, we realized oftentimes the partner doesn't get that involved. And the partner is kind of left out unless he or she attends every visit, they're not going to be on top of what's going on with the man with prostate cancer. And there's always, with any kind of cancer, there's so many questions to be asked and answered. And our goal was to ask and answer those questions. And of course, the man, I think this book will be very useful to the man also who has prostate cancer,
right?
Because he's unable to, no urologist can spend the kind of time going into the details we did in the book. And if you have prostate cancer, you want to understand as much as you can about that disease, diagnosis, treatment, and so forth.
So, I think you're spot on with that. We started Prostate Cancer Awareness Week and screening back in '89 and things like that. And we learned a long time ago what drove men in to see their doctor get screened was their significant other many times, most of the time, actually. Men tend to be very stoic and nothing's going to harm me. I remember seeing a patient that came in to see me I said, "Why are you here?" He said, "I don't know." And he said, "Well, who told you to come here? Why are you here?" He said, "Well, my wife told me to come here." "Well, why'd your wife tell you to come here?" "Well, because I get up every hour at night to urinate, and it bothers her. It doesn't bother me." And that it's that sort of the thing that happens. We know that. And also, it's always great to have another pair of ears involved. And you involved a psychiatrist, Dr. Key, to participate in the book. Tell me about that.
How that happened, Neil and I wrote about 15 chapters or so. Well, we presented our outline to Johns Hopkins University Press, who is the publisher.
By the way, congratulations on that. That is
Thank you. We're happy with that.
Get done. Yeah.
They liked the book. They liked the concept. Something we did that's unique in each chapter. Each chapter starts with a little vignette, a little story, and it allows people to kind of relate. Oh, I can see myself in this little story. But after Johns Hopkins read our book, read our outline, they came back to us and said, "We like your book, but I think you need to deal with some of the psychological and emotional considerations in dealing with a man with prostate cancer." So we were able to find Dr. Key. He's with University of Texas Medical School in Austin. He wrote about 4 chapters in the book on the essentially the emotional aspects of dealing with cancer. And it's just, he did a terrific job. It's a great addition.
That's a really key part of the book. I found that to be very educational. You don't see that in a lot of books.
No, I don't think you do.
So you talked a little bit about the format. So each chapter starts with a sort of a real case scenario, right? And then
it does.
And ends with a solution. I think that's great. The other thing you do is you have questions in there for the man and his partner. Tell me a little bit about the purpose of those questions at the end of the chapter.
We envisioned a man and his partner who would be visiting with the urologist and still have some questions about that individual. We essentially answer each of the questions. We put questions at the end of the chapter, but we answer the questions in the chapter. But they're the kind of questions the patient and partner would want to go back and ask the urologist about his case in particular. So it just gives them some outlines. And patients ask all the time, what should I be asking a doctor? So we gave them those suggestions.
Good. But it's always good to have patients write all these things down, have them. Sometimes, as you know, it gets a little bit annoying when somebody comes in. You see they have a page and a half of questions. Yeah. But anyhow, it's important.
We only had 3 or 4 questions in each chapter.
Yeah. But it's I think that's important. So tell us, how can urologists and their patients get the book?
Right now, it is available online for sure at both Amazon.com and I know at BarnesandNoble.com. It may be available in the Barnes and Noble stores as well. I haven't been in my local one to see, but it's easy to buy it online. The price of the book is around $15, and obviously Amazon will send it to you in a couple of days. Yeah,
they're great at that. That's what it costs to park in our parking lot to see us. So how the book's been out for a number of months. How are the sales doing?
We talked to Johns Hopkins a couple of nights ago, and they said the sales are going quite nicely. We were very pleased with the numbers. So people are buying it. I might mention too that because if they're going to hunt for this book, I tell my patients, type my name in, Mobley, and prostate cancer as the search, and it'll come up. Dr. Baum would tell his patients, type in Baum, prostate cancer, and they'll find the book on the search engine right away. Good. The other thing we noticed that grand rounds, a lot of people when you that have been on here, when they Googled, one of their comments from grand rounds usually is in the first 5 things. So this is good to have you here doing this. Okay, so I guess you're looking at this being on the New York Times bestseller list. Are you planning on a movie or a Broadway play with this or what? I don't think we're going to get to that point, but I really do hope that a lot of men and their partners who are suffering from prostate cancer will buy the book. I really think it will be, as you said, and you were so kind with your comments. I think they'll get a lot out of the book. But bestseller? No, we're no James Patterson.
Well, I think there's some things, and it's not so far fetched from a Broadway play. I think you guys know Evan Goldfisher. He wrote a bunch of songs that are related to urology and vasectomies and
Yeah, that's right.
various. I don't know if you've seen them, but they're good. And this could happen. I mean, that's a whole different thing, but I find it very interesting.
Yeah.
Dave, I really appreciate you taking time from your busy schedule to be with us. Any closing comments you want to make or anything?
I appreciate the opportunity, Dr. Crawford. The only thing I would say really is I think there's as you mentioned, there are a lot of books on prostate cancer. I think this one is unique. I think it's especially unique because we use a vignette format. And it's so, as a patient is reading a chapter, it's almost like a story. It's kind of like a novel with some didactic teaching in it. So I think they'll like the format better than a lot of books.
I agree. And it's like, I've mentioned this to a lot of patients, but if there's and I mentioned this to Neil too, if there's any way some cards or QR codes or something can be out there that you can hand patients. I'm trying to get in our discharge notes for patients that they get. Recommend that you take a look at this. We have some other things in there about markers and so forth, and that can be with that we can send them to the title and where to get it and so forth. Again, thanks so much, and let's get together later and see what else comes out of this and talk about where the book is. So
we'll see you in San Antonio for sure.
Yeah, have a good holiday season, you guys.
Thanks.
Thanks.
You too. Thanks. Bye-bye.